in March, I was infected with COVID-19 and spent 8 days in the hospital, struggling to breathe and too exhausted to get out of bed. The dedicated doctors, nurses, and hospital staff were my allies in the fight against the virus, putting their own health at risk to care for me. It gave me an up-close and personal perspective on what our healthcare workers have been up against since the start of this pandemic. So dedicated are Utah's healthcare heroes that when the call went out from New York for help, 100 volunteers responded, giving the exhausted doctors, nurses, and respiratory therapists much-needed backup. They spent 14 days assisting New York area hospitals, working day and night to care for desperately sick people, people who were not even allowed to have family members at their bedside. Utah healthcare heroes are not just found in hospitals, they are in our long-term care facilities, our veterans home, and in parking lots, standing in the heat to collect test samples for hours at a time. They are found in blood banks and laboratories, searching for the treatments and working on drug trials to offer relief and hope to patients now and in the future. No summer vacations or even holiday weekends for these extraordinary caregivers. Their own families must take a back seat. The fight against the virus and the demand on their skill continues for the month ahead. They gave me my health back and returned me safely to loved ones. I thank them for their help, and I yield back.